Business executives routinely evaluate the performance of their employee benefit plans. Very few executives are aware of the impact Medicare has on the cost of their employee benefits. Understanding the fundamentals of Medicare enables executive decision makers to recognize opportunities to significantly reduce employee benefit costs while simultaneously improving employee satisfaction.
Okay, so you're trying to understand Medicare, and it can be really confusing. Like, when do you have to start thinking about all this stuff? Well, if you're coming up on the magic 6-5, it's time. Or if you're like a lot of us and retiring later, you're ready as soon as you don't have employer health insurance anymore. Maybe you already have a Medicare plan, but you're thinking about switching it up a little bit. No matter what's going on, you need to know some basics. So let's get started. Medicare has 4 parts: A, B, C, and yep, you guessed it, D. Plus there's this 5th thing called supplemental. We'll get back to that. So what do the letters really mean? Well, Part A is for when you go to the hospital.
Paging Dr. Bender.
And you get it just by signing up for Medicare. We have a whole nother video that explains signing up. For most, you get Part A automatically, and it costs you zero, nothing. Parts B, C, and D, on the other hand, are optional. If you want them, you buy them. Part B is for when you go to the doctor. Stuff like routine physicals, blood pressure checks, tests, things like that. Part C, well, let's say you want to add eye care or dental coverage or something else. That's where Part C comes in. It's also called Medicare Advantage, and it's pretty cool. Part C combines A and B, along with some of the other stuff you want. Then there's Part D. Part D is prescription drug coverage. Now, you can buy it on its own, or you can get it with Part C and wrap the whole thing up in one neat little package. You can also buy a supplemental policy if you want. They're called that because they cover some of the costs not included in A or B. Well, there you go. Those are the basics. Still want to know more? Go to Medicare.gov or check the other videos in this series at MedicareMadeClear.com.
A growing number of Americans are working after age 65 for a variety of reasons, including good health, the need for income, or to maximize future Social Security benefits. A recent Pew Research study estimates that almost 20% of the U.S. workforce is represented by workers age 65 or older. These Medicare-eligible employees are typically enrolled in their employer group health plan. Most of these Medicare-eligible plan members have access to suitable cost-saving Medicare plan options. The problem is they don't know how Medicare works and can't compare the cost of their group health insurance plan with their most suitable Medicare plan options. The 2020 Kaiser Family Foundation Employer Health Benefit Study found the average annual employer health plan contribution to be nearly $16,000. The average annual plan member contribution is almost $5,600. Most eligible plan members would be better served with a suitable Medicare plan. Most eligible plan members choose Medicare Advantage plans with $0 monthly premium. After the eligible plan member enrolls in Medicare Part B and transitions to Medicare, the plan sponsor saves an average annual benefit cost of nearly $16,000 per eligible plan member, and eligible plan members save between $5,600 to over $10,000 in annual premiums and cost-sharing expenses. Everybody wins. Social Security gives workers the option to take benefits anytime between age 62 and 70, and it offers incentives to those who are willing to wait. Those who claim income benefits at age 62 have to accept 75% of what they receive at full retirement age. Social Security automatically enrolls early income benefit recipients in Medicare Part B at age 65. Most retirees either cannot afford to wait or don't think the trade-off is worth it. Yet despite the prospects of getting larger payments from Social Security, 62 is still the most popular age for people to claim their Social Security income benefit, according to the government's most recent data. Medicare problems and challenges. The 2019 CMS Medicare marketing guidelines prevent the side-by-side cost comparison of Medicare plan options. The inability to compare the known cost of Medicare plan options prevents Medicare beneficiaries from making fully informed plan selections and impairs price competition in the marketplace. The 2019 CMS Medicare marketing guidelines regulate marketing activities of licensed insurance agents. Medicare plan providers will not approve marketing materials that compare the known cost of approved Medicare plans with competing Medicare plan providers. It is not in their self-interest to do so. The Social Security Act requires Medicare beneficiaries claiming Social Security income benefits prior to or after full retirement age to be automatically enrolled in Medicare Part B on or after age 65. The unintended consequence of this regulation is an estimated 50% of working Medicare beneficiaries are paying an employer health plan premium and a Medicare Part B premium which they don't need and can't use, representing waste and abuse of over $9 billion annually. April 16th, 2018, Charles Wright, Principal Advisor at Health&Wealth Advisors, LLC, presented the following to the Secretary of Health and Human Services, the CMS Administrator, and the Health and Human Services Inspector General. Request for approval of an employer group waiver plan waiver that provides financial relief for Social Security recipients automatically enrolled in Medicare Part B while simultaneously enrolled in an employer-sponsored group health plan by allowing enrollment in a group Medicare plan, EGWP, without the requirement to be simultaneously enrolled in the employer-sponsored group health insurance plan. July 18th, 2018, the following response was received from CMS. After careful consideration, we have determined that waiving the relevant Medicare secondary payer statute and regulations would not be in the interest of the Medicare program. While we acknowledge that some working Medicare beneficiaries may have elected to enroll in Part B in error, we do not believe limiting the MSP rules as proposed is the appropriate remedy. CMS does not acknowledge the fact that automatic enrollment of Social Security recipients into Medicare Part B has the unintended consequence of creating waste and abuse for beneficiaries simultaneously enrolled in an employer health plan. The estimated annual cost to Medicare beneficiaries and employer health plans is over $30 billion, or the equivalent of about 5% of the Medicare budget. The Medicare Planning Fringe benefit was created to convert this specific Medicare program waste into significant employee benefit cost savings. Let's find out how this is accomplished. Large employers have the opportunity to reduce employee benefit costs significantly by offering the Medicare Planning Fringe benefit to Medicare eligible plan members. These cost savings are accomplished by educating Medicare eligible plan members about how the Medicare program works. Eligible plan members receive a customized Medicare plan comparison report. This report documents the known costs of the plan member's most suitable healthcare plan options. Exposure to this cost-saving information, along with consultations with a benefit advisor, compels most Medicare eligibles to enroll in a suitable Medicare plan. The Medicare Planning Fringe benefit provides a compliant process for transitioning Medicare eligible plan members to the most suitable Medicare plan option. Plan sponsors and plan members benefit from significant cost savings as a result of the employer offering the Medicare Planning Fringe benefit. Mary Smith just turned 66 after working for Acme Manufacturing 20 years. Mary plans to work until she's 70. Her husband, John, is 67 and retired. John is a dependent on Mary's health insurance plan. John has Medicare Part B. Mary pays $400 a month for her Acme Group Health Plan. If John wasn't on her plan, Mary would pay $200 a month for health insurance. Mary learned about the Medicare Planning Fringe benefit that helped her understand her Medicare plan options. Mary and John completed the Medicare Fact Finder. After receiving their Medicare plan comparison report and completing the telephone consultation, Mary and John made some decisions. Mary has decided to enroll in Medicare Part B. Then, she and John will enroll in $0 monthly premium Medicare Advantage PPO plans. Mary and John's transition from Acme's health plan to Medicare will save them from $5,300 to over $10,000 in annual premiums and cost-sharing expenses. This is what Mary Jones' Medicare Plan Cost of Ownership Summary looks like. What compels the transition to Medicare? Medicare eligibles motivated to transition to Medicare after being exposed to the known cost of suitable Medicare plan options is explained by the economic law of substitution. The economic law of substitution was established by Austrian economist Hermann Sarich Gaussen in the mid-1800s. The economic law of substitution generally states that consumers want to get the maximum satisfaction for what they spend for goods and services. Let's use Medicare Supplement Plan F to illustrate how the economic law of substitution would apply. Medigap Plan F is the most comprehensive and expensive Medigap plan option available. The benefits provided by Medigap Plan F are regulated by CMS. The price of Plan F policies is determined by each individual insurance carriers. Regulated benefits provided by Medigap Plan F policies are the same for all insurance carriers. The price of a Plan F policy is the primary variable differentiating Plan F policies among competing insurance carriers. The economic law of substitution predicts that when the benefits of a Plan F policy sold by different carriers are the same, the lowest price Plan F policies will be preferred by consumers. Suitable Medicare plans are those plans that satisfy the minimum level of benefits required by the Medicare beneficiary. If the known cost of Medigap Plan F is less than the known cost of the employer health plan, the plan member will generally prefer Medigap Plan F. The economic law of substitution is the foundation of price competition. The Medicare Planning Fringe benefit introduces a new form of price competition to the large employer group benefit marketplace. Acme Manufacturing has 2,500 active group health plan members. 10% are age 65 or older, representing 250 Medicare eligible employees. Acme's management has decided to offer and promote the Medicare Planning Fringe benefit to their Medicare eligible employees. It's anticipated that 80% of their Medicare eligibles will transition to Medicare within 12 to 36 months. Assuming each Medicare eligible costs this self-insured employer around $25,000 in annual benefit costs, when 200 transition to Medicare, Acme will save approximately $5 million in annual employee benefit costs. The break-even point for recovering the $250,000 benefit costs is the transition of 10 employees to Medicare, or 4% of their Medicare eligibles. The Medicare Planning Fringe benefit delivery process starts with messaging to eligible plan members. The promotional plan is prepared by the project coordinator, which will identify the communication strategies and resources necessary to accomplish the goal. Eligible plan members will have several methods to respond, which will result in the completion of the Medicare Fact Finder. The Medicare Fact Finder smartphone app will be available for Apple and Google devices. The app enables completion of the Medicare Fact Finder and delivers short educational videos about how the Medicare program works. Eligible plan members can complete their beta test feedback form using the app. The Medicare Fact Finder will be available online for completion. Benefit representatives will support completion of the Medicare Fact Finder over the telephone as requested. Completed Medicare Fact Finders will establish a first in, first out queue for processing by benefit advisors. Benefit advisors will analyze the Fact Finder data and prepare customized deliverables for each eligible plan member. Benefit representatives will schedule and confirm telephone consultations with benefit advisors. Eligible plan members will complete their consultations and make benefits decisions with a high degree of confidence. Eligible plan members will complete the beta test feedback form. Benefit advisors will then complete the Medicare enrollment process. Eligible plan members will then transition to Medicare.